California lawmakers will consider banning cosmetic genital surgery on intersex children. Sacramento, California. River Gallo both are part of a group supporting a bill in the California legislature that would ban cosmetic surgeries on children born with atypical genitals until they're old enough to consent. California, the legislation has made public an emotional debate that has been simmering for decades in the intersex community. Advocacy group, surgeries in extreme cases in which the gender of the child is unclear can result in female genitalia being constructed on someone who later identifies as male or vice versa. More common are pediatric urologists who perform the surgeries called SB 201 extraordinary. Even within the intersex community, there is no consensus on how old a person should be to consent to surgery, with advocates saying there is a fine line between ensuring a minor is old enough to make the decision without pressure from their parents, doctors, or peers, and not forcing all kids to wait until after puberty. The legislation would require doctors to wait until patients can give informed consent, meaning they are mature enough to understand the benefits and potential risks of surgery. Pediatric urologists said the exact determination of when a minor can consent relies heavily on a doctor's interpretation, prompting concern that doctors would be subject to litigation if a minor later changed his or her mind. Alvarez said she was born with external female genitalia and undescended testicles. As an infant, Dr. Steve Lehrman, chief of the UCLA Division of Pediatric Urology, agrees that there is not enough known about the long-term outcomes of complex genital surgeries. Those surgeries Lehrman said doctors, including himself, need to step up and recognize that such surgeries have previously had questionable outcomes and should be further studied. But, The California Medical Association, an influential lobbying arm of doctors in the state capitol, opposes the bill, saying parents and physicians should determine what is in the best interest of a child. Delaying a procedure, But postponing surgery until the age of consent carries risk just as performing a procedure on an infant does, Marchi said. In the absence of the first hearing on the bill is expected early next month. As the bill moves through the legislature, it is expected to bring large groups of intersex advocates with personal stories of surgeries they say were unwanted or unsuccessful, as well as parent rights groups that will argue the government should not interfere in the ability of parents to make medical decisions for their children. Santa Rosa family physician Swaggy Tamar Mattis disagrees, saying that without clear medical data supporting surgery, doctors should wait. 3 former U.S. Gallo, a 28-year-old filmmaker, said it wasn't until recently that he heard the word intersex after having kept his own medical history a secret for much of his life. He was born without testicles. At 12, Gallo said, even at 16, he didn't feel mature enough to consent to the surgery that his parents and doctors said was needed. He said his parents, Visit the Los Angeles Times
Raindrop, drop top, smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park, pot.